So sometimes it's difficult if the spinal curvatures are not in a right condition. A posture might change, or it could be vice versa. We don't hold the posture correct, and then we might create a damage. So there could be, a little backward bend, like a lordosis. It could be a forward bend, like a kyphosis. But standing erect is what? So if a spinal structure is not straight enough, so like a scoliosis, so that creates damage to the other organs which are going to also be over there. So this is how we can get to know how our spine is in order or not. So normally, as we have seen, there should be some good, nice cushion between the bones, and there are these nerves coming out. This is all in a normal structure. But sometimes what could happen? The bones can undergo some change. The disc can have some problem. The nerves can get compressed. So we'll have some better image also. And why the damage can come to all this is it's our own doings. We probably are not holding a correct position when we carry things, when we stand, or it's a muscle strain here. The disc can have some damages. I'll have a better slide here. So there could be various reasons. The disc. So normally it should be nice, thick cushion and padded very well. But sometimes that lubricant agent may not be sufficient. So the external ring, which is called, we call it as annulus, and there is some nucleus. So sometimes the wetness of it, the lubricant aspect begins to dry. Sometimes what happens, that little nucleus can pop out. It can just bulge. Sometimes it could just penetrate the other aspects as well. So it can herniate. And sometimes it can just shrink, it can just thin down, and many times it just gets degenerated, and the bones also are changing. So there are so many conditions happening. We address it as a back pain, but the issue could be several depending upon what the organ is over there. We are talking more on the lower back because that's the commonly seen, and such changes are seen mostly either in the lumbar region, the lower back, and also in the neck, the herniation or the disc bulge situation. So we see this in a more clear way, that what could be the reasons why the back pain should come. So it may not be all in a person, or it could be more than one reason in a person at different stages of their condition. All this we have seen only as the skeletal format, but all this is covered and nicely supported. We are able to move because of the muscles, the tendons, the ligaments that support it. And sometimes it may not be actually the bone, it may not be the nerve, it may not be the disc, but it could be a muscle. It could be the tear in the muscle. Probably we have neglected, we have not done probably a proper body posture while lifting things, or probably we over-exercise, because we all are health freaks these days. We know not how much to do, how much to carry, how much to strain the body. Or sometimes it could be just our laziness, our sedentary life, or like we work in the office, and these days everything is work from home. That means more screen time. So our postures may not be each time perfect. So there are so many reasons. So earlier, when we were in our college days, we used to get the truck driver example who keep on driving for long back in India. There's so much expanse of land. So right from North India to South India, they are driving. So we used to get those examples. But these days, the office goers are the best examples, because their life is sedentary as well. And the strain that comes on the back, the postures these days, even if we travel through an MRT, we see everybody's on the phone, whether the person is sitting, standing, leaning somewhere. So it's an odd position and the neck is down. So that's a perfect awkward position where you are actually straining those muscles, nerves, or you're just causing faster degeneration of those regions. So this was like a very brief and a quick, what we can say in a nutshell, what's going on in the back, or what is there that we should know. So it is having a fivefold or approach. Internal medicine aspect is there, external therapies are there, some form of yoga, little bit of diet and lifestyle. All this combined only is going to be your solution. So half-baked knowledge, little bit of here and there, no. Everything has to be fully attended to. In Ayurveda, we've got, when we talk about internal medicines, and we've got certain kinds of therapies where sometimes these Vata, Pitta, Kapha, these energies, they are not very into imbalance. They are just increased little bit here and there. So with little bit of medicines you give, you can pacify them in the body itself. And sometimes they are in so aggravated condition that you have to eliminate it out of the body. So this elimination therapy is what Ayurveda's everybody talks about, called panchakarma. So panchakarmas are nothing but a fivefold therapy. There is some medicine given which you can, vomit out. Some medicine is given through the oral route where you can purge out. Some medicine is given through the anal route or like an enema aspect. Some medicine through the nasal route. Sometimes there are some ways to remove or let out blood. One of the form is the leech, which you see in the picture. So that is called as a panchakarma aspect. Over here, now we're coming back to the medicine aspect of the back pain. Ayurveda, of course, definitely focuses mostly on the herbs. But yes, people ask, oh, there are metals with Ayurveda and all. So that is entirely a different aspect called as Rasa Shastra, which deals with it. But predominantly what we practice is with the herbs, and not so metals are used. And there could be different combinations. Either it's a single drug and give it in a powder form, or some decoctions are made, or some medicines are prepared in the ghee format, or sometimes there is some juice secreted out of it. So there are different forms of medicines, which we call like a gulika or a rasayana, leyam, tailam, kashayam, arishtam. And there are different forms, like you're not doing a major panchakarma, you can start with simple oil applications, which is called as abhyanga. You can have some heat fermentation, which is called as kivi. You can do some intensive oil therapy called as spiritual. There is a very beautiful treatment called as kadivasti. So we are going to see the picture in a short while. And these two words which you see over here called as Sneha Basti and Kashai Basti, these are typically the panchakarma aspects of it, where you put in the body through the anal route some medication. It could be in the oil format, or it could be in some decoction format.